Good morning. Today we're going to perform a hemoglobin determination using an H2 hemopoint hemoglobinometer. It's important to remember that you need to verify the identity of the patient, and you need to have the patient's medical record and check the medical record against the patient's identity.
Morning.
Good morning. How are you doing this morning, sir?
I'm fine.
Today I'm going to perform a hemoglobin test on you. Have you ever had this performed?
I have.
Okay. Do you have any questions about it?
No, ma'am.
Okay, very good. You're going to look at the patient's fingers. You're going to look for good circulation or perfusion. You are only going to use the middle finger or the ring finger. You do not use the thumb or the other two fingers. You are going to make sure that you do not use a finger for a capillary stick that has a ring on it. So for today, the middle finger is the appropriate one. This patient's fingertip is warm and it's pink and it looks like it has good circulation. We're going to do the stick on the lateral aspect of the finger. It's best for purposes of most blood tests involving capillary sticks to perform it on this lateral aspect, which is toward the little finger. In that way, you will be able to have a clear hanging drop, which is necessary for most tests. You are going to take an alcohol swab. You are going to clean the area by scrubbing it very well with a circular motion. You are going to allow it to dry. I have my cuvette, my test cuvette. I have a 2x2 gauze. And I have a Band-Aid in case I need it later. You're going to support the finger, take the lancet, hold the lancet firmly against the finger, and press. You're going to squeeze, and you're going to wipe that first drop. Then you're going to squeeze again and get a good hanging drop, and you're going to hold the cuvette right against the drop until it fills. Could you please hold that? Thank you. Next, you're going to wipe the bottom of the cuvette. You're going to insert it in the holder. Manually close the holder. How are you doing, sir? Are you feeling okay?
Fine, ma'am. Thank you.
Okay. This test occurs very rapidly, and very often, in case there's a problem, you might want the patient to remain in place. You're going to dispose of these supplies, which are contaminated, in a biohazard container. While we're waiting for the test results, I'm going to bring over the patient's record. And now the patient's test results are 16.7 grams per deciliter. This machine also will estimate the hematocrit at 49%. I'm going to document this in the record. I'm going to punch OK, stating that I want to retain that information in the machine. And now I'm going to document the procedure. I'm going to document the results, and then I will dismiss my patient.